Alrighty. So just to start us off, what are your general experiences with the device, and have you seen any improvements with their condition?
Long story short, the device, I love the concept. I really do. I do like that you can swivel. The setbacks, I would say, if you want to take jot some notes, I would
Yeah.
say it's quite heavy, but
Oh, I see.
it could be because I mean, every patient is different, but I say that because I'm currently undergoing treatment for carpal tunnel pain in my
Mm-hmm.
right hand,
Mm-hmm.
relying on this hand for everything. So it might not be fair because to me to say that to you because I do have that pre-existing injury in my right wrist,
Oh no, it's
which
totally fine.
you know what I mean. But then
Mm-hmm.
again, anybody who's in my shoes uh, would could potentially have an injury like that,
Yeah.
and you develop atrophy and you develop like repetitive stress disorders with your only working hand because you use it for all your everyday ADLs, activities of daily living. And so that's one thing to keep in mind. If you can find a way to kind of cut back on some of the material,
Oh yeah,
uh,
for sure.
that would be ideal for sure because it's
Mm-hmm.
very simple for me to try to pick this up even now.
Oh
I
yeah.
things I shouldn't do something like that.
Mm-hmm.
But of course it's not meant to be portable necessarily.
Yeah.
Understood.
Mm-hmm.
Um, so another thing I would say is, can you see the
Yeah, we
device?
can see it.
Okay, so I would say like, I'll show you my hand. The spasticity can kick in certain movements. Like if I try to bring it up like this, you can see it's fighting me.
Yeah.
It's not it's not like a smooth like this,
Mm-hmm.
This fights me the moment I try to and even crackle sometimes because of the tone, which is the
Oh, I
muscle
see.
stiffness.
Mm-hmm.
So I would add some wrist support. You have right here, you have, I hope the phone doesn't fall off the bed. Let me see if I can move the device. You have from here, from this this starting point here
Mm-hmm.
to where the hand actually goes in. You have some room there, but there's no support. And
I
these
see.
back here, I can see where you guys' intention was coming from, but the support is needed in like more of like the wrist. Like I would say, like
Mm-hmm.
if you can put it here, like more a little closer,
Oh, I see.
maybe a little tunnel, something more snug,
Mm-hmm.
something that gives you tactile feedback, meaning there's you know what that means, like
Yeah, like something that's touching it or having in contact with it.
something hugging it. Obviously, something you can adjust. That'll be up to you guys to kind of look into what things would be appropriate for that. I could
Mm-hmm.
recommend, and in fact, I have something I can show you here. Um, this is an established company, so these guys already have been doing what you guys aim to do for a long time.
Mm-hmm.
So this is a resting splint. You can see it has the straps, right?
Yes.
And the back you can adjust. Look, see how it's basically padded throughout the whole bottom
Yeah.
with Velcro?
Mm-hmm.
So you can adjust however according to your needs. Sometimes you need it tighter, sometimes you need it looser, depending on the size and width of your arm and whatnot. So I'd say get something that maybe like a little tunnel, a little cushioning, not a tunnel because you need an opening on the
Right.
top.
Exactly.
Something that can corral it essentially. That would
Mm-hmm.
provide feedback, which is great. It also would provide support. And another thing, you could I mean, I'm sure this is patented, but it's not theirs. Velcro is not theirs to copyright. You
Mm-hmm.
could also on the finger brackets here,
Yeah.
you can't. Yeah, I love. I really do. I admire you guys so much for this design. Uh, but in using the device, for me, one thing I have to stress is we have to remember that we can only do so much with one hand. So for
Right.
me to place one hand is tough enough homework.
Oh, I see.
Let me see if I can show you. So let's say we take these guys out, right?
Mm-hmm.
Also, put like a little Velcro, something that can hold it, perhaps.
Oh, okay. Well, yeah, we can fix that pretty fast way.
So put some Velcros here to help this stuff not like keep whipping back and forth when I'm trying to put it in. I mean, they were staying because I've kind of folded it a lot, but
Oh, I see.
something here to gently hold it while I put my arm in, and then I could, you know, I could strip it from there and put it here. Same thing on the other end. Now on the fingers, going back to that point, you have this little lever, which is great, and you have these little holes that would hold it in. That to me was very tricky. In fact,
Oh,
it
I see.
broke me the first couple times, to be honest with you.
Oh, okay.
Yeah, so like I'm trying to give you a demonstration here. See, you can see that it's very challenging for me to try to, you know, get it into that little hole where this knob here would hold it in, right? And then also to at the same time like actually hit the target up here, the little hole up here. So what I would say instead of this, if you want to keep this for now, I'd say shave this sponge down
Yeah,
quite
definitely.
at least, you know, I don't know. I'd say I'd go as far as like a half an inch. I know that's
Oh, okay.
aggressive. A half an inch or a little less. Like if you wanted to keep this design, but also add some grooves here on this thing. I know there's grooves, and I love this. I love the curved texture there. It's great. Good job, great job on that. It's feedback. It's definitely reassuring to the user, because anytime we have texture, anytime we have sensation, anytime we have any sort of input, don't take my word for it. Ask any renowned therapist; they'll tell you that that's huge.
I see.
You know, feedback, neurofeedback. Well, yeah, it's feedback. So I would add some, like, I'm sure you've seen them, like little like individual finger, kind of like if you took a sponge and you had like, you know, you curved it in there and you had like slots for the fingers, like little, you know what I mean?
Yeah.
Okay? So I would add something like that. I would say like add more like a strap like that, like here. Let me see. Yeah, like something you can Velcro. You can Velcro it.
I
off,
see.
Flip it off to. So basically, have a sponge here with some, you know, a cushion that you could potentially custom make. At least making certain sizes, like genetic sizes, to start off. You know, in terms of like how thick are your fingers, how far off are you from this portion.
Right.
And those are things that I'm kind of overloading you maybe, but I would put there, and then a strap instead of this I don't know what, this lever here, and then the hole here. So basically, like here, I love the security of the hole. It's great for stability because it doesn't go anywhere once it's in.
Right.
But getting it in is a challenge.
I see. I see.
And also, we want to consider a patient's you know, like how the ease of use, basically. Because a lot of us people with stroke and bleeds and all that stuff, they don't have the mental capacity, or they won't be able to have the patience.
I see.
Trigger it easily, and you can see how frustrating it can be. It can be heartbreaking for them. They see this lovely device, they're all geared up for therapy. The moment they go to use it, they tend to spend like 40 minutes trying to put it on.
Oh, I see. I see your point. Yeah.
Take into account the emotional aspect of a lot of these patients. That's also huge. I hope that you take a note on that. Like,
yeah, for sure.
This is actually a pretty cool concept where you can pivot. Another thing about that, I'm blanking out, but so like, but the thing is, like, if I have my arm in here and I'm trying to pivot, like the forearm doesn't flex.
I see.
Like, you know, there's something there. I can't quite verbalize it right now, but like you would want something that pivots from back here, from where you're supposed to pivot naturally, in the, you know, in the elbow, which would be great. And then also, I know you were developing like maybe have something like exercises, something
like visual cues.
Yes, visual cues, something. I've all the big companies with millions of dollars doing this. They have like, little mini games, little things like that.
Oh,
I
I
would,
see.
if you have any gamers in your church, try to come up with simple, very simple, goal-oriented games. Like get the apple in the basket, move it from one side to the other. Big job on the little nubs, the plastic nubs, the rubber nubs. That's good for when you have it on a hard surface. We'll keep it in place.
Hmm.
Um, Potentially move this to where the forearm, I know that was kind of the goal, but if you can see here,
Hmm.
me, if I had my arm in here, my arm is, my medication hasn't kicked in really,
Oh, I
so
see.
it's pretty stiff. But like if I have, like you can see where this thing would stop
Yeah,
me,
yeah,
right?
exactly. Hmm.
And then what? Because you basically have all this room out here, but this stopping me from going there.
Right.
So perhaps like extend that, make it more snug,
Hmm.
add a wrist support, like guidance in the middle,
Hmm.
a foam, like a half foam tunnel or something.
Right, right.
Uh, and then yeah. So, you know, all these other things you gotta be, I would want you to consider. Engagement, ease of use, lightweight. Uh, Really, those are, I think, the biggest things that takeaways I can give you.
Alrighty. Thank you very much for your input. It's very nice to hear them. Really, it really is something, we can't experience in high school without, someone like you who's, willing to
Yeah.
participate. This experience, it really is, all fortunate to you. So thank you very much for coming down to talk with me. But yeah, with that said, thank you very much.